On the 10th and 12th of this month, the Uganda Medical Association held its annual general meeting at Silver Springs in Bugolobi, here in Kampala. The meeting was called to, among other things, discuss the employment situation of medical workers, as well as their remuneration, which remains dangerously low.
And one of the problems we have been facing in Uganda is unemployment, underemployment. That is one of the key issues.
The meeting also sought to look outside Uganda's borders to other countries where medical personnel can seek for employment.
We are going to sign a memorandum of understanding with the Ministry of Health of Rwanda and other countries.
This is in addition to increasing the funding of health services in the country.
And one of the things we talked about as an alternative to ensure that funding of the health budget is increased was the National Health Insurance Bill, which also the Minister of Health commented about and gave us details of the nitty-gritties which are in there.
As part of the general meeting, the association elected new leaders, with the members picking the long-serving Secretary General, Dr. Herbert Luswata, as the new president.
Along with other people, and one the Vice President, Dr. Frank Asimwe Rubavinda, Secretary General, Dr. Mirembe Joel, the Treasurer, Dr. Irene Asava, and others on the team.
Luswata is confident that the election of a new cabinet ends the turmoil that engulfed the association after some members sought to dismiss former association president Dr. Oledo following his decision to commit the membership to President Museveni's re-election bid. However, Dr. Oledo challenged this move in the courts of law.
The case of UMA, which is in court about the previous leadership, my understanding right now, since the other term ended, I would say, I'm not a lawyer, but I think now those issues are taken by invets. I don't think we still have a case, but the lawyers will guide us more on that.
The new association president has given us an indication of where he wants to lead the Uganda Medical Association.
So we have a plan of working with the government and ensure that the quality of the doctors who are being trained is good, by ensuring good supervision of medical schools to ensure that everything that is required is there, ensure that there is the teaching is taking place. The other thing we want to work on is to ensure that we have a good internship policy, which will be able to lay out how interns are supposed to be paid, who is supposed to pay them, when are they supposed to finish and complete internship. We feel that if we have a policy which is already laid out, the issues of interns striking because of pay and many other things will reduce, or probably we shall be able to cure that problem for good.
Joyce Nakato, NTV Weekend Edition.